New concerns over the flu. This year's strain of influenza has already killed 20 children across the country. One of them, 12-year-old Michael Messenger of Clay Township, Michigan. This strain affecting all of the United States except Hawaii. So why is this virus taking the lives of healthy people in just a matter of a few days? 7 Action News reporter Kim Russell joins us with more on what doctors are telling her. Kim, what have you learned?
You know, doctors are seeing widespread flu across the country and right here in Michigan. As a matter of fact, Henry Ford Health System, they're issuing restrictions on visitors to try to prevent the spread, not just to prevent sickness in patients, but sickness for visitors. For example, they're asking people with symptoms to stay home, not visit patients. And they're also asking children 12 and under not to visit patients in the hospital because children are so susceptible to serious complications. In recent weeks, the state has seen an increase in cases of the flu. One strain of what doctors call influenza A is getting many people sick.
The strain that is circulating right now is the influenza AH3N2. This specific strain has been associated with more severe disease, more hospitalizations, and even, as we say, death.
Dr. Catherine Reyes is Director of Infection Control at Henry Ford Health System. She says the flu vaccine is less protective than hoped for this year because it only protects against certain strains and often mutations occur. But with this more serious strain getting people sick, they see people who are vaccinated often suffer less severe symptoms.
It's still important to get vaccinated if you have not done so.
As for why it's happening now, the flu virus spreads more quickly in the winter because it can travel further in dry air.
To understand, the virus particle in itself can float in the air from 3 to 6 feet. And you don't have to spread it just by coughing or sneezing. Even merely talking can help spread the virus.
Dr. Reyes says children and the elderly are more at risk of serious complications and should not delay getting treatment.
Your individual is especially high risk. Please do not delay seeking care because we have antivirals, we have medications that can treat the flu and are most effective when given early.
Now, a reminder of the symptoms to watch out for. Flu symptoms include severe fatigue, coughing, sneezing, muscle aches, and also a sudden fever. If you have any of those, just be aware. You might want to get yourself checked out sooner than later so those medicines work. And this is not just happening here in Michigan. The CDC sent out a tweet just yesterday saying the flu is considered widespread in every single state in the United States except for Hawaii. Reporting live in West Bloomfield, Kim Russell, 7 Action News.
All right, Kim, we all have to take precautions, washing our hands, not touching our eyes and our nose. Have to be very careful, and you too with that little baby in your belly.